PCA Practice Test 2026 Personal Care Assistant, Full Course Hand Hygiene Gloves. Question 1. What is the minimum duration recommended for washing hands with soap and water? 10 seconds. 20 seconds. 1 minute. 5 seconds. CDC and health guidelines recommend scrubbing with soap for at least 20 seconds. Question 2. When is using an alcohol-based hand rub not appropriate? After touching a patient's skin. When hands are visibly soiled. Before putting on gloves. After removing gloves. If hands are visibly dirty or contaminated with blood/body fluids, soap and water must be used. Question 3. Which infection requires the use of soap and water instead of alcohol-based hand rub? Influenza. Clostridium difficile, C. diff. Common cold. HIV. Alcohol does not kill C. diff spores, mechanical friction with soap and water is required. Question 4. True or false, wearing gloves is a substitute for hand hygiene? True. False. Hand hygiene must be performed before putting on and after removing gloves. Question 5. When should a PCA change their gloves? Between different tasks on the same patient. If the gloves become torn. When moving from a contaminated body site to a clean body site. All of the above. Gloves should be changed when torn, between tasks, and when moving from dirty to clean areas. Question 6. What is the first step in the hand washing process? Apply soap. Wet hands with clean, running water. Scrub the backs of hands. Turn off the faucet with a paper towel. The first step is wetting hands with water before applying soap. Question 7. In the sequence of putting on PPE, donning, when are gloves typically applied? First. After the gown but before the mask. Last. Before the gown. Gloves are the final item donned in the PPE sequence. Question 8. In the sequence of taking off PPE, doffing, which is usually removed first if using the standard method? Mask. Gown. Gloves. Goggles. Gloves are the most contaminated and are typically removed first. Question 9. Where should you wash your hands if you just helped a patient with a bedpan? In the patient's bathroom. At the nurse's station. In the kitchen. Nowhere, just use hand sanitizer. Hands should be washed immediately in the closest appropriate sink, usually the patient's bathroom. Question 10. What should you use to turn off the faucet after washing your hands? Your bare hands. Your elbow. A clean, dry paper towel. The used paper towel. Using a clean paper towel prevents recontaminating your clean hands. Question 11. How should you dry your hands after washing? Shake them in the air. Wipe them on your uniform. Use a disposable paper towel. Use a shared cloth towel. Disposable paper towels are the most hygienic option in healthcare settings. Question 12. True or false, hand hygiene should be performed after touching a patient's surroundings, even if the patient wasn't touched? True. False. Surfaces in the patient's environment can be contaminated with pathogens. Question 13. What is the primary purpose of wearing gloves in personal care? To keep the PCA's hands warm. To protect the PCA from bloodborne pathogens and the patient from infection. To avoid getting the PCA's hands wet. Because the supervisor said so. Gloves act as a barrier to prevent the transmission of germs in both directions. Question 14. If your gloves are visibly soiled with blood, what is the correct action? Wipe them off with a paper towel. Remove them, wash hands, and put on a new pair. Put a second pair of gloves over them. Continue the task quickly. Contaminated gloves must be removed and hand hygiene performed before continuing. Question 15. How much hand rub should you use when using alcohol-based sanitizer? A tiny drop. Enough to cover all surfaces of the hands. Half a bottle. 1 teaspoon. Use enough product to thoroughly wet all parts of both hands and rub until dry. Question 16. Why should fingernails be kept short in a PCA roll? To look professional. To prevent scratching patients and trapping bacteria. Long nails interfere with glove fit. Both B and C. Short nails are safer for patients and more hygienic. Question 17. Are artificial nails allowed for PCAs? Yes, if they are short. No, they can harbor pathogens. Yes, if they are polished. Only if the client allows it. Most healthcare facilities prohibit artificial nails because they harbor bacteria and fungi. Question 18. What should a PCA do if they have an open cut on their hand? Wear 2 pairs of gloves. Keep the cut covered and wear gloves during patient care. Don't go to work. Wash hands with bleach. Open wounds should be covered with a waterproof dressing, and gloves must be worn. Question 19. What is the most important factor in the mechanical removal of germs during hand washing? The temperature of the water. Friction during scrubbing. The scent of the soap. The brand of the paper towel. Friction, rubbing, is what physically removes the germs from the skin. Question 20. When should hand hygiene be performed in relation to a patient's room? Only after leaving. Only before entering. Both before entering and after leaving. Only if the patient is sick. Hand hygiene should be done upon entry to protect the patient and upon exit to protect yourself and others.